Hello, I'm Tim Dodge, IABNY's Director of Research and Media Relations, and you're watching Part 3 in our video series, Healthcare Reform, What You Need to Know. In Part 2 of this series, I described some of the functions of the health insurance exchange that New York will be launching later this year. This time, I'll describe some other functions of the exchange and the essential health benefits the plans it offers must provide. As I mentioned last time, the exchange will certify, recertify, and decertify health plans as qualified, and it will provide a number of services to assist consumers and businesses. In addition, the exchange will assign quality ratings to each plan offered, certify that individuals who seek an exemption from the individual coverage mandate are entitled to an exemption, provide to the U.S. Department of Health and Human Services a list of individuals who are exempt from the coverage mandate, provide to HHS the names and taxpayer ID numbers of individuals who are employed but who are eligible for premium tax credits either because their employers don't offer insurance or because the coverage offered is unaffordable, provide to HHS the identities of individuals who change employers and cease coverage, provide to employers the names of employees who cease coverage, and establish the Navigator program, which will be the subject of a future episode in this video series. Now, exchanges must be able to fund their own operations by the year 2015, and the ways they can use their funds are restricted by law. In carrying out their activities, exchanges must consult with healthcare consumers who are enrolled in qualified health plans, individuals and entities who are experienced in facilitating enrollment, representatives of small businesses and self-employed individuals, state Medicaid offices, and advocates for enrolling hard-to-reach populations. The exchanges will have to report on their websites the average costs of licensing, regulatory fees, other payments the exchange requires, and administrative costs. And they must also report monies lost to waste, fraud, and abuse. Now I want to talk about required benefits. Qualified health plans must offer, at minimum, a package of essential health benefits. The broad categories of essential health benefits include ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health management, prescription drugs, rehabilitative services and devices for children with developmental disabilities, laboratory services, preventive and wellness services and chronic disease management, and pediatric services, including oral and vision care. Now, the scope of these benefits must be equal to the scope of benefits provided under a typical employer plan, as determined by a Labor Department survey of employer-sponsored coverage. The package of specific benefits cannot be unduly weighted toward any one of the 10 categories I just mentioned, may not discriminate against individuals because of their age, disability, or life expectancy, must consider the healthcare needs of diverse segments of the population, including women, children, and the disabled, may not deny essential health benefits to anyone against their wishes due to that person's age, life expectancy, present or predicted disability, degree of medical dependency, or quality of life, must cover emergency services without requiring pre-authorization, without limiting coverage for use of out-of-network providers, or without increasing cost sharing for use of out-of-network providers. Lastly, nothing in the law prohibits health plans from offering benefits that go beyond these essential benefits. That's all for this episode. I hope you'll tune in for the next episode when I'll be discussing the standards for navigators. You've been watching Healthcare Reform, What You Need to Know. I'm Tim Dodge. Thank you for watching.